Hello, welcome again to iHealth Hub. Thank you so much for your continuous engagement. Today, I'm glad to bring us another topic, that is the allergic conjunctivitis. Allergic conjunctivitis is a very, very common eye condition with its prevalence ranging from 15 to 40% globally. This is quite a huge number. There are a lot of things that we can learn in this topic. And for that reason, I'll be doing it in series, maybe 4 or 5 videos, not exceeding 5 minutes each. And I hope by the end of that discussion, we'll have learned something. So let's get started. So what is an allergy? An allergy is an abnormal immune response to substances. We call them allergens. These allergens may be things like dust, smoke, pollen grains, perfumes, fiber, animal dander, and so on. The body may react differently to these substances. You may get one that may present with skin irritation and or skin discoloration and so on. You may get another one presenting with respiratory condition like the asthma, and one can also have a presentation in the eyes as allergic conjunctivitis. So this allergic conjunctivitis may occur in isolation as allergic conjunctivitis, but may also occur together with other forms of allergy like the asthma and the allergic dermatitis. That is the skin presentation. So the chronic symptoms causing discomfort with allergic conjunctivitis may lead to anxiety, frustration, loss of concentration, reduced quality of life. One is not able to normally do their daily activities, and sometimes can lead to depression. So what are the symptoms? They may range from mild to severe forms. An individual may get one symptom or multiple symptoms, and the most common ones are the red eyes, watery eyes, and the eye itchiness. Other symptoms may include burning sensation, feeling of sand or foreign body in the eyes, and also having sensitivity to light. One may have a swollen eyelids or some transparent swellings on that clear layer that we call them conjunctival cysts, and one may also present with mucoid discharge that may cause the lashes to stick together. So what are the types of allergic conjunctivitis? We can have the seasonal allergic conjunctivitis, where it occurs in certain seasons. Maybe it is a season where there are a lot of pollen grains, or it's harvest season, and so on. The symptoms may come and clear as the seasons clear. We can also have the perennial allergic conjunctivitis, which happens throughout the year, and this is due to exposure to continuous allergens like the dust and animal dander. We can have the vernal keratoconjunctivitis, that is the VKC. It is a much severe form that mostly affects children and young adults, and mostly occurs in warm climates. We can have the atopic keratoconjunctivitis. This one is a much more severe form and may cause very serious complication if not treated. We can have the giant papillary conjunctivitis, and for this one mostly occurs in contact lens wearers, where there is a reaction to the contact lens deposits. So the diagnosis is by the medical history and also doing the eye examination. So how do we manage this allergic conjunctivitis? The first thing is that we are supposed to avoid the allergen or that substance that is causing the irritation. How possible is it? Maybe, for example, you are working in a place where there's a lot of smoke emission or fumes. The best thing to do is to put on the protective clothing. Those are things like the goggles, the masks, the aprons, gloves, and so on. Very, very important. And what happens for the children? I know it can be challenging because we also need these children to go out and play. We said there are some conditions like the short-sightedness that can occur due to lack of outdoor activity exposure. So it is very important these children to be going out. But what we can be doing is to be taking these children for regular eye checkup. We can also, all of us, be going for regular eye checkups, and also using the prescribed medication correctly. Okay, and we can be doing cold compressions to try reduce the feeling of itchiness, a burning sensation and discomfort. And for this cold compressions and the correct use of the eye medication, I'll be doing a different video. Please check on it later on. Other measures that we can take is by closing windows when it is that season of a lot of pollens, or the harvest seasons where now these substances can gain access to the house. And we can use the indoor purifiers to try reduce the allergens that may be suspended in the indoor environment. Also, we can be washing our beddings and carpets regularly, and doing damp dusting daily, so that we clear the fine dust that may collect over the day. That's it for this video. Please check out my next video on the treatment and complications of allergic conjunctivitis. Let's meet then.